Welcome to Inside the College. I'm Dr. Maggie McMenamin, president of Union County College, and we're launching this episode of Inside the College with the chairman of the Union County Board of County Commissioners, Mr. Al Mirabella. Welcome again to the show, Al. We're thrilled to have you here.
Thank you, Madam President. It's always a pleasure to spend some time with you talking about important things going around our county.
Well, I'm going to try to remember to call you Commissioner Chair and Commissioner Mirabella, because I know that the status changed effective January 1st. So before we get into COVID and all the wonderful things that the county is doing to serve the residents, please tell us just about this transition to Commissioner from Freeholder.
Yeah, I mean, when you think about it, the commissioner is used as a result of how you speak to county government officials in every other state in the union. New Jersey was really unique to have freeholder as a title, and it went back down to colonial days, and it just was viewed as not a very inclusive term. People felt not so great, not having opportunities that everybody should have, and one of our commissioners actually put a bug in Governor Murphy's ear, and that kind of spearheaded the drive towards the end of last year to make that move. And it's been talked about for several years. I'm glad we finally made the change, and we're all embracing the new term. Although after this is my 24th year as a commissioner, it was hard to change the title. At least from hearing it. Now I'm getting used to it, and it's a good change.
We're getting used to it here at Union County College as well. But frankly, it'll help us because as we attend national events and talk about the tremendous support that we get from our Board of Commissioners, when we talked about freeholders across the country, nobody knew what we were talking about. So it is common language. So I'm welcoming the change. Commissioner Chairman Mirabella. But I may resort to just plain Al to prevent from going back to freeholders. So thank you for joining me on the show. We have so much to talk about today. Now, the Union County Board of County Commissioners has done just an incredible job in response to COVID. We're 1 year since the declaration of a global pandemic and a national emergency. So much has happened during that year. What I'd like to start with is learn more about the county testing facility at Kane and also the mobile testing that the county has spearheaded. I know that it was the first county-run facility in the state, but tell us more about it and how people can get testing.
Well, I mean, we were really fortunate and recognized very early in the process of understanding what this pandemic was going to mean to set up that testing site at Kane and really work to open it up to all members of our county, whether residents or people that work in Union County. And you're right, we were the first, and we feel like we were the most efficient. To date, we've tested over 140,000 people in and out through that center. I give big credit to Kane for making the facility available. Dr. Repollet has been a good supporter of this effort for sure, and Dr. Farahi before him. But we really feel, and your emphasis and part of your question was, it's still important, and we want to make sure that people know that they should continue to get tested. You can't let our guard down now. And if people need to understand how they can get tested, they can call for an appointment or go online. A lot of information is on ucnj.org. Right on the homepage, you'll see a link to testing and food distribution and vaccinations. So that's kind of where we put all our information for the public to know. And it's very efficient, in and out. And we encourage people to continue to get tested.
I know that we had mobile testing here on the Cranford campus and on the Elizabeth campus, both very successful mobile testing initiatives. Is the county planning on continuing the mobile testing as well?
Yes, we are. In fact, on your campus for sure, we've gone to other school districts and tried to get teachers and students tested. Out in our community, we've had mobile testing in every municipality around our county. So yeah, we'll continue that, recognizing that everybody doesn't have a car or not convenient to get to Kane University and Union. So really, we feel that's really important to have both the on-site at Kane and the mobile testing, and we're going to continue that.
I know Dr. Fauci and all the public health experts have said that testing is the key to getting this virus under control. So I know that I speak for everyone else in the county in thanking the Union County Board of County Commissioners for your work getting those testing centers up and running and available to all of us, not just the folks who can drive somewhere, but those walk-up testing centers critical as well. But the pandemic, beyond just the medical impact, the greatest impact that we've seen is the economic impact and really the hunger, the food issues, the poverty, this superimposed on people who were just living on the edge. So tell us more about what the county has done to help people in need.
Yeah, so we've partnered with the food bank in New Jersey to buy the food through the CARES Act, federal dollars that came through Union County to put packages together for people in need with food insecurity and hunger. We didn't want anybody to go hungry in our county, and we set up that site at Kane. There were some remote sites in Plainfield and Elizabeth and other places throughout our county. Again, on UCNJ, there's a full list of upcoming distribution sites, and we've thanked many Union County College students and faculty that come and support that effort, volunteer, loading cars and helping people along the way. It's been a real partnership between the college and the county throughout this whole process. I know early on you donated some materials and some leftover masks and stuff, at least at that time when they were really scarce to find, and that was a big help. But your support's been critical, and your staff is always ready to step up and help the county. It's one of the joys that I have is the partnership that we have.
Sure. When the pandemic first started, we opened our cabinets and our shelves and donated every piece of PPE, masks, gloves, gowns, and all of our respiratory therapy equipment, our ventilators and BiPAP and CPAP machines to Trinitas or one of the local nursing homes. We even did some donations to one of the local ambulance corps that hosts our EMT and paramedic students. But it has been an all hands on deck initiative to respond to this pandemic.
Yeah, and what I liked the most, Dr. McMenamin, was we didn't even ask. You guys just went and found the equipment and found the supplies and said, we're here to help. What can we do? And that's appreciated.
Yeah, thank you. Thank you. And our students were thrilled to have the opportunity to be part of the testing site, to do some volunteer work. When the county sent out the call for healthcare volunteers, our nursing faculty, our EMT and paramedic faculty, and our students stepped up to join your volunteer medical corps to assist at those locations. So we were proud to do that, and it really is reflective of the community commitment and civic engagement that we encourage in our students and our employees. So we're happy to do that. Now things have changed a little bit, and we're into 2021, a full year into the pandemic, and things seem to be more optimistic. Obviously, I still remember the day that Pfizer came out and revealed that their vaccine was so tremendously effective, 95% effective, and the Moderna vaccine coming on its heels, and now the Johnson & Johnson vaccine being distributed right here in our own county. Things are looking better. Are you more optimistic?
I really am. I mean, more people are getting tested. I think we've vaccinated over 26,000 Union County residents, either first dose or second dose. And the J&J vaccine coming online, the federal government kind of getting their act together as far as supporting one voice, one kind of focus on the priority of getting vaccinated and tested and all the rest. That's really helped from the federal government on down, through our senators, Congress people, our state delegations, been all really trying to help. We're all kind of working from the same, song sheet, if you will. So that is very positive. And, with the J&J vaccine, you mentioned the distributed testing. We hope we're going to be able to take that J&J vaccine out and do kind of a mobile vaccination. That will be really helpful for senior centers. Nursing homes kind of had their own allocation. Hopefully they're all on their way to getting done. But, there's a lot of senior centers or,
Sure.
Aging population who really need it, who can't travel to Kane.
Sure.
So we hope we can get that out. And a single dose seems like the most critical and the easiest way to get that done.
Wonderful. Now we're going to talk more about the county vaccination program after we take a break. This is Dr. Maggie McMenamin. You're on Inside the College with County Commissioner Chair Al Mirabella. We'll be right back after these messages. Welcome back to Inside the College. I'm Dr. Maggie McMenamin, president of Union County College. My guest for today's episode is County Commissioner Chairman Al Mirabella. Commissioner Chairman Mirabella, welcome back to the show. And we're talking about what everybody's talking about, COVID-19. But I want to learn more about the vaccination program. We've talked a lot about testing, and nothing will change. Testing is critical. But now that we have these vaccines, tell us about the county vaccination site.
Yeah, and so with testing comes continue to wear your masks, continue to social distance, continue to wash your hands. I mean, I think that'll be something moving forward that we're going to get used to as a community. But so the vaccination center is running very well at Kane University, and the issue, if there is an issue, has been the amount of people that want to get the vaccine. And we're delighted that everybody wants to get it at this point. Yeah. Is just the number of doses, and we've been urging Governor Murphy, and he's been very receptive to us to get more doses to Union County so we can get more in the arms of our residents. And that's been helpful. But if you need to call, you can call this number. For people that don't have computers, there's a call-in center, and let me give you that, 908-613-7829.
So that's for people who are maybe less tech savvy and can't manage a computer appointment. They can call that number?
Yes. And we noticed early on that not everybody had access to technology, and libraries were closed, with some seniors used to go and use the computers there. So we needed to establish a call center, which we did very quickly, and that's helpful for people to get appointments as well.
Suppose they don't speak English, though. We have a lot of diverse people in the community who maybe English isn't their primary language. How are you managing that?
It's bilingual, so anybody that calls that center will have the opportunity to speak to somebody with Spanish speaking skills, and we hope to get to everybody. And I think once we get through the vaccination and have enough supply to meet the demand, the next chore is going to be making sure that people that are reluctant or not enthusiastic about getting a vaccine are really urged about the importance of that. So we'll cross that bridge when we get to it. That's important because we want everybody to get vaccinated. We'll have to do a special effort to make sure people know it's safe, which it is, and it's been convenient as possible.
Now, I know that the county has the vaccination site at Kane, but it's not the only place in the county where you can get a vaccine. Can you tell us a little bit about what's happening at Trinitas Hospital and the city of Elizabeth?
Yeah, Trinitas has been a great partner with Union County to make their staff available in Elizabeth at the Dunn Center. Through FEMA has been involved to try to organize to get more doses out to people. And even in the pharmacies, I mean, we're encouraging people to find any way they can to get the vaccine, and it's been a good team effort. And
So they can go to Rite Aid pharmacies in the county, ShopRite pharmacies in the county, and we've been, like you, here at Union County College, reminding people that there are more than one list to get on, there's more than one way to get a vaccine, that certainly they should pursue the county option, either through the UCNJ website or through that phone number, but they can also pursue it through the local pharmacies or through the FEMA site at the Dunn Center that's being run by Trinitas.
Correct.
So, any opinions on the Johnson & Johnson 1-shot versus the Moderna Pfizer 2 shots?
Well, no, I mean, obviously 1 shot is more convenient for people. It's one and done. No, I think they're all effective and important. As I said before the break, we hope the J&J site we can take on the road, that vaccination, and we hope that's a good solution for people that aren't as mobile.
Sure. I know several stories of people struggling to get their elderly relatives to a site for a vaccination. So at home, near home, local vaccination sites, particularly with that Johnson & Johnson 1-shot, could be a game changer for all of us. So
yeah, and I'm really happy that the governor included teachers and staff, and not only the college level, the high school, and all teachers to be qualified or be part of that group that should seek and get vaccinated. It's a long time coming and very important.
Absolutely. Absolutely. Well, I know that I speak for everybody in the county, and I want to thank you as the leader and your entire Board of Commissioners for what you have done to support, to help the people who need it the most in our county. They're our neighbors, they're our friends, they're our relatives, and the way the county has stepped up this year has been truly extraordinary. So thank you for that. Now,
well, yeah, thank you, and really, thanks goes to the county manager Ed Oatman and Deputy County Manager Wagner, our directors, first responders, medical care workers. Everyone stepped up at the right time and created this effort.
Well, I know I also speak for everyone else when I say I'm sick of COVID and I'd love to talk about something else besides the pandemic. So let's give our viewers something to talk about besides COVID. What else is happening with the county and with your initiatives?
Well, it's interesting because being chairman in 2020 and carrying over to 2021, we were just starting the process of rolling out the initiatives last year when COVID hit and changed our focus. So we're trying to, rekindle some of those initiatives, dust them off, if you will, and get some of them going. And part of them are, this Project Fresh Start, which is taking laundry service and shower service out to our community, taking care of what homeless we have, starting to do some work with the LGBTQ community with the regular dialogue of communication through some panel discussions, and also business-friendly LGBTQ sites. So we hope we can reinvigorate that effort so that people feel comfortable and included. One of the greatest things I think we're doing in 2021 is repurposing the juvenile detention center. It wasn't cost effective for us to keep that center open. We're able to save millions of dollars by closing it and having our juvenile offenders, if you will, housed in another county. But we repurposed that for the new fire academy in Union County. We're delighted for that. And the fire department across our county are really anxious. And there's a class already in there training new firefighters. So that's really helpful. And we want to get back to some concerts, some fun things in the parks. The weather's warm today, and people are anxious to get outside. So we're going to have some drive-up concerts. A U2 band is coming up to celebrate St. Patrick's Day coming. And I'm sorry, looks like we'll miss our parade this year, unfortunately. And you were the Grand Marshal one year, very proud with hundreds of students surrounding you. It was a great visual and a great compliment to you. I want to have those events now, and hopefully we'll be in line to do that. I'm excited about it.
Well, we're at the college, we're trying to slowly reinitiate more face-to-face activities if we can do it safely with social distancing. But we also recognize that people do need to get out. They need to get contact with other individuals. So, mindful of safety, I'm hopeful, as you are, that we can all get outside this summer and see more people and do more things, and those concerts sound like just what the doctor ordered.
Yeah, it will be fun to get back somewhat to normal, although I think we're going to have a new normal. Some of the things that we have learned, we should carry forward, pandemic or not. I mean, some of these communications are very easy to have online. I always prefer sitting next to you and having this conversation, but it works, and it's effective means of getting communication out. So there will be some things that will carry over, but I'm looking forward to seeing people and being out in the community. It's nothing better for me.
Well, we're on the road to recovery. We all see light at the end of the tunnel with these vaccines being rolled out as they are. We want to thank you for joining us this morning on the show. This has been enlightening, to say the least. It's been an extraordinary year all around, and certainly an extraordinary year for the Union County Board of County Commissioners, as they have stepped up to the plate and helped all of us make our way through this year of COVID. But we're all looking forward to the next year, where we will be reemerging from our cocoons and rejoining one another out in public for some of these events. So, Commissioner Chairman Mirabella, thank you for your leadership, and thank you for joining us this morning. And we look forward to seeing you all again next time inside the college. I'm Dr. Maggie McMenamin, President of Union County College. Thank you for joining us this morning.